It's a quiet Tuesday morning. Margaret, 72 years old, pours her coffee and walks to her mailbox, just like she has done for the last 20 years. But today there's a letter waiting for her. She opens it. Her hands start to shake. The letter says her Medicare Advantage plan, the one that covers her doctor, her heart medication, her dental visits, is being terminated at the end of the year. She reads it again and again. She thinks there must be a mistake. Medicare can't just end. But Margaret is not alone. This year, nearly 3 million American seniors opened that exact same letter, and many of them are about to make a mistake that will cost them their coverage, their doctors, and thousands of dollars for the rest of their lives. Please don't close this video, because what I'm about to tell you could save your health, your savings, and your peace of mind. Hello, I am Jocelyn. I'm a senior policy analyst, and for years I've helped retirees just like you understand the complicated rules behind Social Security, Medicare, pensions, and retirement income. And today I need to talk to you, seriously, about something happening right now in 2026 that the news isn't explaining clearly enough. I'm going to walk you through the exact federal rule behind these plan terminations. I'll tell you the 3 legal protections you have under Medicare law, and I'll give you a step-by-step action plan to keep your coverage safe. But please, stay with me until the very end, because there is one hidden mistake, a deadline buried in the fine print that is silently destroying the future of seniors all across this country. Most people don't even know it exists until it's too late. So pour yourself a cup of coffee, sit back, and let me explain. Let me tell you about Robert. Robert is 67 years old, a retired postal worker from Pennsylvania. Married to his wife Linda for 41 years, 2 grandchildren, a small garden, a simple life. For 3 years, Robert had a Medicare Advantage plan he loved. It covered his cardiologist, it covered Linda's diabetic supplies, and it cost him $0 in monthly premiums. Then, in October of 2025, the letter arrived. His plan was being terminated. Just like that. Gone at the end of December. Now, Robert is a careful man. He didn't panic. He went to Medicare.gov. He found a new Medicare Advantage plan from a different insurer. He enrolled in January during what's called the Medicare Advantage open enrollment period. He thought he had done everything right. But in February, Robert went to see his cardiologist of 15 years, and the receptionist told him, "I'm sorry, sir, your new plan doesn't include Dr. Patel in its network." Robert was stunned. He tried to switch back, but it was too late. You see, during the Medicare Advantage open enrollment period, you are only allowed one change. One. That's it. Once you make it, you're locked in until October. And it got worse. Robert tried to leave Medicare Advantage entirely and buy a Medigap supplement policy to go with original Medicare, but because more than 63 days had passed since his old plan ended, he no longer had the federal guaranteed issue right. The Medigap insurer looked at his medical history, his heart condition, and denied him. Then they tried a second company. Denied. A third. Charged double the premium. In one small mistake, one missed deadline he didn't even know existed. Robert lost his doctor, lost his protection, and now faces 20% out-of-pocket costs with no maximum limit for the rest of his life. Don't let this happen to you. Let me show you exactly how to protect yourself. Now let me explain, calmly and clearly, what's really happening using only official government sources. Dear jury, the core rule Medicare Advantage plans are private insurance contracts. Every year, these insurance companies renew their contracts with the federal government, with CMS, the Centers for Medicare and Medicaid Services. And here is the part nobody tells you. Insurance companies are legally allowed to terminate, non-renew, or shrink the service area of any Medicare Advantage plan at the end of any year. According to the Kaiser Family Foundation, for the 2026 plan year, 2.6 million seniors had their Medicare Advantage coverage terminated. That's 13% of everyone in an MA prescription drug plan, more than double last year's number. In Vermont, more than 90% of Medicare Advantage members lost their plan. In Wyoming, South Dakota, Idaho, New Hampshire, and North Dakota, over 60%. This is the largest Medicare Advantage shakeup in history. What the law gives you. When your plan ends, federal law gives you 3 enrollment windows. Window 1, the annual open enrollment period, October 15th through December 7th every year. This is when most seniors should make their changes. Your new coverage starts January 1. Window 2, the Medicare Advantage open enrollment period. January 1st through March 31. But, and this is critical, you can only make one change during this period. Window 3, the special enrollment period for plan termination. This is the one most seniors don't know about. If your plan is terminated, you get a special enrollment period that runs from December 8th through the end of February of the following year. Use it. The hidden 63-day trap. Now listen very carefully. This is the part that ruined Robert's retirement. When your Medicare Advantage plan terminates, you have a federal guaranteed issue right to buy a Medigap supplement policy. This means no medical questions, no denial for pre-existing conditions, no premium hikes for being sick. But you must apply no later than 63 days after your Medicare Advantage coverage ends. Miss that 63-day window, and in 47 out of 50 states, Medigap insurance companies are legally allowed to deny you coverage based on your health history. Only 3 states protect you year-round: Connecticut, Massachusetts, and New York. If you live anywhere else, that 63-day clock is the most important number of your retirement. The drug coverage trap. One more thing. If you leave Medicare Advantage and go back to original Medicare, you must also enroll in a separate Part D prescription drug plan. If you don't, you face a permanent late enrollment penalty. 1% of the national base premium for every month you went without drug coverage, added to your premium for the rest of your life. These are not rumors. These are rules straight from Medicare.gov, KFF, and AARP. So what do you do right now? Here is your 3-step protection plan. Step 1. Check your mail and verify your plan status today. Every fall, your Medicare Advantage plan is legally required to send you a written notice called the Annual Notice of Change or a non-renewal letter. Don't throw it away. Don't assume it's junk mail. Open it. Read it. If it says your plan is being terminated, circle the date your coverage ends. Then count exactly 63 days forward and write that date down. That is your Medigap deadline. You can also verify your plan status directly at Medicare.gov or by calling 1-800-MEDICARE. That's 1-800-633-4227. Step 2, talk to your state's SHIP counselor before you make any change. This is the step that would have saved Robert. Every state has a free, federally funded service called SHIP, the State Health Insurance Assistance Program. They give you one-on-one, unbiased counseling. They don't sell insurance. They don't earn commissions. Go to shiphelp.org or call 1-877-839-2675. Schedule a session before you choose a new plan. A SHIP counselor will tell you whether your doctors are in the new plan's network, whether your medications are covered, whether you qualify for the 12-month Medicare Advantage trial right, and whether you should go back to original Medicare with a Medigap policy. Step 3, keep every document. Apply for Medigap within 63 days. If you decide to return to original Medicare, first, keep your plan termination letter. That letter is your legal proof of guaranteed issue rights. Second, apply for a Medigap policy immediately, not next month, not when you get around to it, within 63 days of your coverage ending. Federal law is on your side, but only inside that window. Third, sign up for a standalone Part D drug plan at the same time. Don't wait. Don't assume original Medicare covers your prescriptions. It doesn't. If you follow these 3 steps, you stay protected. If you skip even one, you could end up like Robert. Now, I need to be honest with you. YouTube does not always show you my videos. Even if you've subscribed, even if you've clicked the bell, the algorithm decides, not me, not you. And these Medicare rules, they change every single year, sometimes every single month. So I want to invite you to something I built for seniors by Seniors Advocates. Click the link in the description below to join the Global Senior Alerts official WhatsApp channel. When you join, you'll get 2 things for free. First, an instant download of our Senior Benefits Protection Guide, a plain English handbook covering Medicare, Social Security, pensions, bank rules, insurance, and senior travel rights. Second, real-time alerts sent directly to your phone whenever the government changes a rule that affects your retirement. No algorithm, no middleman, just the facts, delivered straight to you. Please, don't wait until a letter shows up in your mailbox. Don't wait until you're standing at the doctor's office being told you're out of network. Protect yourself today. Protect your spouse. Protect your savings. This is Jocelyn. Thank you for trusting me with your time today. Stay informed. Stay protected. And remember, In retirement, the rules don't bend for you. You have to know them before they catch you. I'll see you in the next video.